The reason that we're stuck with the hybrid system that is the ACA, the very flawed hybrid system that is the ACA, is because the stakeholders who were not the taxpayers were able to buy their legislators and have them, insert the clauses and the must-haves and the ultimatums into the deal to get it to a point that they would support it. And there's no other way to put it. It's a poison pill. If you're the insurance companies, for example, looking at this, you win either way. You win if you get the ACA and, you get essentially guaranteed profits by the government and all the various things that were put into that, you win. If the ACA becomes too expensive and everybody's mad about the cost and everything and they want to go back to the way things were, well, then you win because you were winning under the way things were. Making sure that no matter what happens, you win is exactly what your lobbyist should be doing for you if you're sitting down at a strategy session on K Street saying, okay, here's my worry. And they're going to say, well, listen, here's what we'll do. And either outcome favors you. Okay? Again, boom, that's what you pay those people for. If they do a good job, that's what they tell you. If you do a good job working for your insurance companies, you lobby the legislators to do it that way. If you're one of the legislators who gets fat checks from the insurance companies for your reelection campaign, you see that it's done that way. That's how the system works, right? But then that's how you end up with what we have now, a patchwork system with interconnecting levers and gears that don't work very well now, but that if you take them away, you're just going to break an already flawed system. And what are you offering instead? And here's the real question. Does what you're offering instead equal better health outcomes for the American people? If you can't answer that question with a resounding yes and explain your thinking, right? Show your work on the math paper, well, then we shouldn't even be talking about reform because you don't have the best interest of the people who actually pay for all of this with their tax dollars in mind. Irish Rail may be a scandal, although I thought it was a wonderful, if a little bit warm ride, but U.S. healthcare is a scandal because of the way those numbers add up on a piece of paper. There's no way you should be doing worse than every country on that list unless you're somehow providing a better service at the end, right? I'll pay more if we get more. We pay a lot more and we get a lot less, and that's a scandal. It's incumbent upon the people that want to, and I'm using air quotes with my hands, fix healthcare to explain how they're going to improve all those things at the end user side of things, right? If they say something like, we're going to free you from having to buy insurance or getting a big penalty, really? Is that going to compensate you when you get sick? When you don't have something? That's the problem, ladies and gentlemen. They may say that this benefits you if you're a fine, healthy person, but that's a temporary condition. As my dad said, to be so-called able-bodied is a temporary state of affairs. And then when you're not, what sort of health care do you deserve? And since it's coming from your tax dollars anyway, let's ask it this way. You're paying into a system that eventually, unless you drop dead, you're going to also use. How nice and comprehensive do you want your care to be when you do? We'd be better off, ladies and gentlemen, and it would sure be easier to track the money. And you could get rid of all these things like making people have to sign up for health care, even if they're young and healthy, because otherwise the government will hit them with a huge penalty. You'd be better off having a dedicated tax fund. You really would. That just said, listen, all the money from this tax goes into this fund. That fund covers the cost of people walking into any doctor's office whenever they need to and getting treated. One, you'd be able to track the money. Two, you could get rid of all the onerous requirements. And you're probably thinking, that's the last thing I want, Dan. More taxes, going to some other cause, to the rat hole that is government and everything else. But if these other countries' results are to be believed, if you can pull this off the way they pull this off, your overall costs at the end of the day, when you sit down and figure what you have left over versus what you paid out over the year, you should be ahead. Because every one of those countries is ahead of us now. Here's the problem, folks. The problem is we keep focusing on something called health insurance. And, the Republicans will use a great little weasel phrase. Watch the weasel phrases at all time from all politicians. But the weasel phrase in this whole, healthcare reform cycle we're going through now is access to insurance, right? We will make sure people have access to insurance. Access to insurance doesn't mean jack. Okay, people don't need access to insurance. They need health care. Insurance is supposed to be a means to pay for health care. Access to a way to pay for something. I mean, there's a reason there's a lot of steps there. I mean, for example, the Republicans have made noise about keeping one of the very popular things in Obamacare, which is really, I mean, when you think about it, it's something you have to have for a healthcare system really to work. And yet it's something that destroys the idea that private insurance for healthcare is based on, right? They need to be able to discriminate over the patients they take, right? This is an agreement, and the agreement is, okay, you're a good risk, we're a good coverage service, we like the odds here, boom, boom, boom. But if you have to take every risk, even people you would never take before because they're bad risks, well, you have to make up for something like, that on the other side. So if the Republicans are going to really keep the mandate from the Obamacare ACA version of the plan that says that insurance companies can't deny you for having preconditions, then they're going to make that up through something else. And it's likely to be taking caps off what people can be charged and making sure that you say something like, listen, just because you had cancer 5 years ago, we'll make sure that you cannot be denied. You will have access to insurance because the healthcare companies will have to cover you. Yes, but they can charge you $19,000 a month. So it's there if you need it. You just can't reach it. So watch the weasel words.